Anxiety, what it is, how to control a crisis, and 25 symptoms. Treatment of anxiety disorder involves different approaches. Learn more. What is anxiety? Anxiety is characterized by feelings of worry and distress that, when they become excessive, become a cause for concern. Unlike anxiety based solely on expectation, anxiety disorder is a disorder that presents severe physical and emotional symptoms that can disrupt simple daily routines. Causes. It is not known for sure why some people are more prone to excessive anxiety than others. Some of the factors that may be involved are genetics, i.e., family history of anxiety disorders, environment, for example, experiencing a traumatic or stressful event, mindset, or thought pattern, i.e., how a person structures their thoughts or lines of reasoning and, consequently, faces everyday situations, physical illnesses. Among the physical illnesses that may be related to anxiety are cardiovascular problems, such as cardiac arrhythmia, hormonal diseases, such as hyperthyroidism or hyperadrenochromosome, increased activity of the adrenal gland, respiratory problems, such as chronic obstructive pulmonary disease, chronic pain, abuse of drugs, alcohol, or medications, such as benzodiazepines. Even events such as concussions, brain tumors, excess cortisol in the body, and infections by bacteria called streptococci may be associated with anxiety. Relationship between fear and anxiety. It's important to remember that anxiety is a normal human emotion, and it commonly arises when we face stressful situations. Anxiety is very close to worry, fear, or apprehension that things won't turn out as we would like. Prolonged anxiety, so-called chronic anxiety, increases the level of tension and internal stress, which can lead to the emergence of specific or even unreal fears. Types. There are several types of anxiety disorders. The most common are generalized anxiety disorder. Generalized anxiety disorder, known by the acronym GAD, occurs when anxiety persists for long periods of time and begins to interfere with daily activities. The main symptom of the condition is excessive worry or apprehensive expectation. Panic disorder. Panic disorder is a type of anxiety disorder in which unexpected attacks of despair and intense fear occur that something bad will happen even if there is no reason for it or even signs of imminent danger, sociophobia. This disorder is characterized by extreme discomfort and dread in social situations, such as new environments, social gatherings, public speaking, and other similar situations. This behavior is characteristic of a disorder popularly known as social phobia or social anxiety disorder. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, popularly known by the acronym OCD, is a psychiatric anxiety disorder. Its main characteristic is the presence of recurrent episodes of obsessive, intrusive thoughts and, in some cases, compulsive and repetitive behaviors. Post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, can be defined as an anxiety disorder characterized by a set of physical, psychological, and emotional signs and symptoms. This condition occurs because the person has been a victim or witness of violent acts or traumatic situations that represented a threat to their life or the lives of others. When she recalls the event, she relives the episode as if it were happening at that moment, with the same feeling of pain and suffering experienced the first time. Signs. Anxiety can cause mental and physical symptoms. Here are the main ones. Psychological symptoms of anxiety: constant tension or nervousness, feeling that something bad is going to happen, concentration problems, constant fear, lack of control over thoughts, especially difficulty forgetting the object of tension, exaggerated worry compared to reality, sleep problems, irritability, agitation of arms and legs. Physical symptoms of anxiety: chest pain or tightness and increased heart rate, shortness of breath or difficulty breathing, increased sweating, trembling hands or other body parts, feeling weak or fatigued, dry mouth, cold or sweaty hands and feet, nausea, muscle tension, stomach ache or diarrhea. Antidepressants. The treatment of choice for anxiety disorders is done with certain groups of antidepressants, especially those that act well on a neurotransmitter called serotonin. They are suggested for longer treatment due to the low risk of dependence and the ease with which they can be withdrawn slowly and gradually in the final phase of treatment. Anxiolytics. These medications act in various ways depending on the neurotransmitter system they act on. Black label anxiolytics are used in the acute phase of the disease to relieve the physical symptoms of anxiety, acting on the system called GABA, which reduces brain hyperactivity to adequate levels. But they only work on the symptoms without improving the cause. Antipsychotics. Some antipsychotics, such as quetiapine, can be used as palliatives during the most critical periods of anxiety disorders. However, like anxiolytics, they only relieve symptoms, not treating the cause. Natural treatments for anxiety patients already diagnosed with a disorder should make lifestyle changes that can reduce anxiety. Psychiatrist Leonardo Morano suggests some controlling working hours. Adults up to 50 years old should not work more than 40 hours a week. And above that age, it is recommended that the workday be reduced to about 25 hours, explains the doctor. Investing in leisure time. Having moments that escape stress, such as walks in the park, interaction with pets, and travel are important for having a better quality of life and reducing anxiety. More natural diet, including more natural foods, such as fruits, vegetables, and grains, helps reduce the number of chemical additives on the plate. In addition, foods have nutrients that can act directly on neurotransmitters in the brain, substances that can trigger well-being or anxiety. Anxiety attack. What to do during one? It is very important not to try to fight panic, as this is not a conscious mechanism. It stems from automatic brain mechanisms located in automatic or unconscious regions. It is part of a complex defense system of the body. The person can take some actions, resort to relaxation techniques, such as meditation or prayer. For example, use any distraction technique, such as a soft conversation, soft music, calming words, massage in areas of the body that produce relaxation. Control breathing. Is there a cure? Most people with anxiety begin to feel better and resume their activities after a few weeks of treatment. Therefore, it is important to seek specialized help at the nearest health unit. Early and accurate diagnosis of anxiety, with effective treatment and long-term follow-up, are essential to obtain better results and less harm. Living with it prognosis, 15 practical tips to control anxiety, practice physical activities, reduce your daily stress, try controlling your breathing, avoid negative thoughts, invest in foods with tryptophan, drink tea, maintain focus on the present, be more organized, spend time with those you love, dedicate time to self-care, take care of your thoughts to smile more, trust yourself more, develop congruence, strengthen self-awareness, take good care of your sleep time. Foods that reduce anxiety, citrus fruits, vitamin C, present in citrus fruits, decreases the secretion of cortisol, a hormone released by the gland in response to stress, milk, eggs, and low-fat dairy products. Excellent sources of an amino acid, tryptophan, which relieves anxiety symptoms. Carbohydrates, this nutrient raises blood sugar levels, providing energy, well-being, and vitality. Bananas have a high tryptophan content, which helps in the production of serotonin. Meats and fish, they are the best natural source of tryptophan, an amino acid that, together with vitamin B3 and magnesium, produces serotonin. In addition, they contain another amino acid called taurine, which makes available a neurotransmitter called GABA, which the body uses to physiologically control anxiety. Chocolate is rich in flavonoids, a type of antioxidant that promotes the production of serotonin. Spinach contains folate, folic acid, which is a potent natural antidepressant vitamin, because when it is in low concentrations in the body, it also decreases brain levels of serotonin. Symptoms of an anxiety attack. Panic attacks or anxiety crises are a common reaction to anxiety disorders, especially panic disorder. Their main characteristics are uncontrollable feelings of nervousness and panic, feeling of impending death, increased breathing, increased heart rate, dizziness and vertigo, gastrointestinal problems, insomniasis. The physical symptoms are so intense that they can be confused with illnesses such as heart attacks and other cardiovascular events. Relationship between anxiety and depression. Anxiety and depression can have very similar symptoms, such as fears, insomnia, insecurity, difficulty concentrating, irritability. A study known as Kendall's showed that the diagnosis of depression changes to anxiety in 2% of cases, while cases of anxiety become depression in 24%. One explanation for this is that the negative thoughts that a person with anxiety has about themselves can be triggers for depression. In addition, many people with anxiety disorders avoid situations that can trigger symptoms and, as a result, live in a very restricted way, such as not leaving home alone, not participating in meetings and other social events. The more anxiety disrupts a person's life, the greater the chance of them becoming depressed. Finally, both anxiety and depression are often linked to dysfunction of neurotransmitters called which includes serotonin. Diagnoses. The professional will begin by investigating whether there is any physical cause for the excessive anxiety. Meanwhile, they will also have a conversation to analyze and understand what conditions may be causing the problem. There are some biological markers that may also be linked to anxiety, such as cortisol levels, an important stress hormone, changes in blood glucose or sex hormones, among others. If the doctor does not identify physical causes, they may compare the symptoms with the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to understand the condition. Risk factors. Some people are more prone to anxiety disorders. The main risk factors are traumatic events in childhood or even adulthood, stress related to serious physical illnesses, accumulation of stress, personality type. Since some people have a naturally anxious personality, such as perfectionists and control freaks, substance abuse, such as alcohol, cigarettes, and illicit drugs. Tests. To rule out the possibility of physical illnesses, tests such as blood tests, thyroid tests, physical examination during the consultation, neurological tests during the medical consultation. Specialists who can diagnose anxiety are general practitioner, psychiatrist, psychologist, seeking medical help. How do I know if my anxiety is a problem? Ideally, you should seek medical help as soon as the anxiety disorder produces any kind of displeasure or suffering, negatively interfering with your quality of life. Excessive worry about small problems, irritability, explosive mood swings, and avoidance behavior. The person starts avoiding crowded or enclosed places, such as shopping malls, airplanes, elevators, etc., are clear signs of an anxiety disorder. The feeling that the brain won't shut off and changes in daily habits are also important factors. Feeling anxious is normal, but when it becomes persistent and out of your control, it's a good idea to schedule a medical appointment with a psychiatrist, especially if there is excessive worry to the point of interfering with work, relationships, and other parts of your life. Symptoms of depression, alcoholism, or drug addiction, suicidal thoughts or behaviors. Worries stemming from anxiety and its disorders don't disappear on their own. On the contrary, they tend to worsen. Therefore, medical treatment and support are essential. Seeking medical help before anxiety becomes an even bigger problem is also crucial to avoid complications. Treatment. If excessive anxiety is related to a physical illness, its proper treatment will already bring relief from the symptoms. However, if the patient suffers from an anxiety disorder, treatment may involve several approaches. Psychotherapy. Psychotherapy with a psychologist can help the patient understand the daily factors that trigger their anxiety, reduce their symptoms, and work through the events that led them to develop this problem. Some of the techniques used are Freudian psychoanalysis, Jungian psychoanalysis, Lacanian psychoanalysis, Gestalt therapy, cognitive behavioral therapy, Medications for anxiety. Several medications can be used to treat anxiety, such as